when patients presented to the doctors and the family doctors or in the hospital, the main thing is to take full history about the symptoms that the patients are complaining from. So it's the timing of these symptoms, the nature of the symptoms, what happened actually to the patient. Did they suffer from any weaknesses in the upper limbs or lower limbs or in the face? Did they suffer from any speech problems, for example, or any visual problems? And to be aware of the timing, because earlier the presentation of the patient to the doctor, more effective is the treatment. It is very well known fact that treating stroke patients, ischemic stroke patients early will prevent further strokes from happening and will shorten the duration of their stay in the hospital, because it can improve their functionality and the function of their upper and lower limbs quickly. It makes the process of rehabilitation easier. And by clot busting medication, if we are absolutely sure that the patient has presented to the doctors, to the hospital, within the 4.5 hours of their complaint from their symptoms. And these symptoms, again, as I said, is the weaknesses or speech problems or visual problems. And these are the main presentation of the patients with stroke to their doctors. Sometimes we as doctors, we are very much aware of stroke mimics or symptoms which are actually not due to the interruption of blood supply to the brain, and they are mimics of stroke, but they are not actually stroke. Some of these are related to epilepsy or other neurological diseases. Some of these are related to migraine, and the migraine aura, for example, which can be presented with visual problems. As patients with hyperglycemia or diabetes, especially these patients who are on insulin, the patients who are on insulin can suffer from hypoglycemia, and hypoglycemia can cause dizziness, can cause problems with speech, sometimes can cause feeling of being weak and tired, lethargic, and these can be mixed with symptoms of stroke or clot formation in the brain, while they are not, of course, they are not stroke at all.